Hello, Monica.
Hey, how are you?
I'm doing pretty good. How about yourself? How have you been feeling since the last session?
Well, I've been feeling good. I've just been kind of, a little bit in pain, but not necessarily too much.
Okay, so what score would you rate your pain from 0 to 10?
Well, right now it's about 6.
Okay, so it's kind of hurts today compared to last time.
Right.
Can you show me where the pain is?
Yeah, it's right in between here.
Okay. So you've been out of your plaster splint for and you got your stitches removed about a week and a half to 2 weeks ago, right? And you've been out of your splint for 3 weeks, correct?
Yep.
Okay, so can I see your scar to see how it's been healing?
Yeah. I don't know if you can really see it. It's right.
Oh yeah, so it's closed to the so that's awesome. We can begin massaging today.
Okay.
Okay, so the protocol from your doctor suggests that 3 weeks out, when your scar is healed, that we're going to start doing scar tissue massages. And I'm going to demonstrate it to you, and then you're going to show it back to me, and then we can go from there and talk about the plan, okay?
Okay, sounds good.
All right, so I'm going to stick my wrist up to the screen. Actually, you can do it with me.
Okay.
So you're going to push your thumb of your other hand over where the scar is. So push it on there. Yep. And if you have lotion might help make it a little smoother for you.
Okay.
So you're going to rub up and down your thumb area and toward your pinky. Yep, perfect. And then you're going to push exactly on top of the scar. And you're going to push up and down in a circular motion and then side to side.
Kind of like that.
Good, yep.
So with that, I'm feeling a little bit of pain. Just like a little irritation, not necessarily like a direct pinch, but
Okay, so that's normal, but I want to make sure that you're putting enough pressure that it makes a difference, but not too light that you can't feel anything. It is going to hurt, but the point of the scar massage is to, of course, break up the scar tissue that is there from the surgery.
Right.
And if we don't break it up, then other complications can happen down the road. So I'm recommending to you to perform 5 minutes of scar tissue massage 2 to 3 times a day. Okay, so this is something you could do when you're watching TV. Just have a free moment to yourself. But it's very important, so I just want to emphasize that. Okay?
Okay.
And then the last thing that I want to go over today, since we just have a quick session, is your home exercise program. So of course, scar massage is number 1. And the second thing is we're going to do wrist range of motion exercises. We've done gentle ones in the past, but now that your incision is completely healed, we can begin to be a little more aggressive with things. So what I want you to continue to do is the one where you're stretching it down and up. You can use your other hand to pull your wrist down.
Yeah, I think because it gets stuck right there.
Yeah. Good. So you can bend it down some more. Bend it your wrist down as far as you can go.
Okay. So that's still very tight.
It's still really stiff? Okay. Good. It's looking good. And then what about bringing it back the other way? So back this way. Good. It's looking good.
It's definitely tight.
Yeah.
Maybe I can go a little more, but I'm kind of scared to push it a little more.
Okay, so that's fine. I'm definitely gonna need you to push it though, since I'm not there with you. Since this is a telehealth session, I'm gonna need you to really push it yourself. Okay. So at home, I want you to be doing this 3 times, 30 seconds for each direction. Okay.
Sounds good.
The last thing that I want you to do at home, so there's 3 things until next session next week, is grip strengthening. So I don't know if you have like a little rubber ball, possibly silly putty or Nerf, like a Nerf ball from your kids or something that you could possibly borrow. But
Yeah.
I want you to find something that's squishy and you're just going to squeeze it with your hand. You can do this, but I know it's going to be hard for you to do this motion, which is why I want you to grab onto a ball.
Okay.
This is just really important to do because the grip strengthening is something that translates to your everyday life. You know, cooking something, you need that strength to do any activity really. So at home I want you to do 2 sets of 10 for the grip strengthening. So now I'm going to ask you to relay back what I said to you. Do you remember your 3 home exercises that I want you to do?
So, I actually wrote them down. So you want me to do?
Oh, go you.
Massaging for 5 minutes twice
Yeah.
a day. Pushing it, pressing it as much as I can resist, but not too like that nothing is happening. You want me to do the motion of bringing it down, bringing it back, as well. And you also want me to press with the ball, whether I can find like putty or ball.
Yep. Awesome. Well, that concludes our session for today. Any other questions for me?
No, but I'll probably have a couple next time we meet.
Okay, sounds good. So our next telehealth session for you is Thursday at 11 a.m. Does that still work?
Yep, that sounds like a plan.
Okay, and of course, email me with any questions if you have them or any pain pops up along the way. Until next week.
Definitely will do.
Okay, thanks so much, Monica.
Thank you. See you next time, doctor.
Bye.